Hello and welcome to my YouTube channel. The Lab Chick here. I hope you've had a wonderful week. So today we are going to talk about urinary tract infections. As the name suggests, this is an infection that affects the urinary tract and it is caused by bacteria, commonly the Escherichia coli. Well, mostly women are affected by UTIs than men, and this is because of the conditions of the vagina that encourage growth of bacteria. One thing that you should know about urinary tract infections is that they affect the urinary tract, and if they're not treated, they can cause kidney disease. So what are some of the symptoms that will indicate that you have a UTI? For example, if you're having a burning sensation when you're urinating, you feel pain when you want to urinate, then you definitely might be having a UTI. Also, there's always the persistent urge to urinate, like after every few minutes you feel like you want to urinate. And when you check your urine, you'll realize that it is cloudy. That is also another sign that you might be having a UTI. The urine might be smelly. It will produce a very strong smell. And let's not forget about the yellow discharge. Like for example, when you check your panties, you'll realize that there is some yellow discharge. That will indicate that you have a UTI. And also there is pain in the abdomen, on the lower area, on the pelvic region. You'll feel some pain, and at times it can be accompanied by itchiness of the private parts, especially the labia majora will be very itchy. So who are at an increased risk of getting a UTI? Women who are pregnant are at a higher risk because there's a higher increase in production of hormones, which affects the normal flora of the vaginal walls, thereby causing the UTI. Also, if someone has experienced a surgery and they are experiencing sepsis, the sepsis might spread to the kidneys, causing a UTI. Also, in women who have reached the menopause, they are at a higher risk of getting a UTI. This is because there's a decline in production of estrogen. Estrogen is the hormone that balances the production of normal flora, normal bacteria in the urinary tract. And then once this estrogen has declined, there's a possibility that the changes will result in overproduction of bacteria, resulting in a UTI. Also, if someone suffers from kidney stones, the kidneys might block the urinary tracts, causing buildup of bacteria, resulting in urinary tract infection. Then there are other people who might have used a catheter for a long time. A catheter is the instrument used by people who cannot be able to urinate on their own. This prolonged use of the catheter might result in a UTI. Now, when you go to the hospital, how is the UTI tested? One thing you will note is that the laboratory technologist or laboratory scientist will instruct you to go and bring a sample of your urine. This urine will be tested along some parameters that check if you have pus cells in your urine, and that will determine that you have a urinary tract infection. Also, your urine might be cultured, and the bacteria that will be identified from the culture will help to diagnose that you have a UTI. Now, So, how do we prevent UTIs? So, one way you can do that is by drinking a lot of water. Drinking a lot of water will dilute the urine concentration and thereby clear out the bacteria. Also, when you go to pee, it's important that you wipe from front to back. That means from your vagina towards the anus and not the other way around. Also, ensure that you empty your bladder as soon after sex. This will help in clearing the bacteria from your sexual partner. Then the fourth thing that you can do is to avoid using irritating female products. That includes soaps and perfumes and any other thing that might irritate the normal bacteria in your vagina. There are other people whom the UTI is caused by using birth control methods such as diaphragms and unlubricated condoms. So if you're such a person, do make sure that you change your birth control method. And then it's important that when treating UTIs, you use medicine. So some of the drugs that are used in Kenya to treat UTIs include nitrofurantoin, doxycycline, clotrimazole pessaries, among others. So that is all we had for today. Thank you so much for watching and see you in our next video. Please do hit the like button and subscribe. Thank you. Have a good day.